A lot of people ask me about veneers, porcelain veneers. Porcelain veneers are very thin layers of porcelain that we cut about 0.5 to 0.75 millimeter of the outer surface and the biting surface of teeth sometimes, and cement or glue them on the outer and the biting surface of teeth. Veneers are to improve the shape of teeth, and sometimes they're used to straighten teeth. Now, because they're very thin and they're very delicate structures, and they're considered non-invasive. But remember, when I say shade, shape, and straightening teeth, I'm talking about very mild malalignment of teeth. Yes, that can be straightened with veneers. Or a little bit of a chip here or there, that can be done with veneer. Or if the discoloration of teeth is mild to sometimes moderate, yes, veneers can be used. But if the discoloration is severe, or if you've lost a lot of enamel from your tooth, or your teeth are really crooked, veneers are not good option for you. Contraindications of veneers. A couple of most important ones are poor oral hygiene. So if the oral hygiene is not good, you will end up with cavities underneath your veneers. And the other thing is parafunction, clenching, grinding, biting fingernails, or some people tend to chew their pen or some objects. That will cause veneers to fail. The other thing is when we place veneers, we have to make sure your bite is okay. Some people have got heavy bites or deep bites, or some people have edge-to-edge bites. It means that when they close up, their top and bottom teeth at the front of the mouth, they hit each other. So these sort of cases, we have to fix the bite to be able to place veneers. How long they last? In textbooks, they say about 7 years. But to be honest with you, we've seen people with veneers and we've placed veneers that last much longer than 7 years. Maintenance with veneers is very important. So if the oral hygiene is good, and if you make sure there's no parafunction and you're careful with what you bite onto, there's no reason that you end up losing your veneers. Yes, at some stage, the cement or glue that we use, it might come off or it might get washed off, and the whole veneer might come off, and then you can get it cemented back as long as it's intact and the tooth is intact. Most people get some whitening done before they get their veneers done, and we match the shade of the veneers to their whitened teeth. But I always tell people it's good to go for a natural white, nothing like a Hollywood white, because the maintenance would be a headache. The whiter you go with the rest of your teeth, the harder would be to maintain them and keep them matching to your veneers. Because veneers, they don't stain, but your natural teeth will stain. Some people say, how many veneers should I get? That really depends. If you've got a couple chipped teeth, we put veneers on them. Some people have got generally short teeth. And we make them longer or we make them more proportionate to their face with veneers. Obviously, they need more teeth. We place veneers on 2 teeth, 4 teeth, 6 teeth, even sometimes 8 teeth. The only thing is that when we work on one side of the midline, for example, if you've got a slightly discolored tooth, just one of those two front teeth, or one of them's chipped and you want to get a veneer done, it's very, very difficult or sometimes impossible to make them look exactly the same because of the way that the light reflects. We might be able to get the shape, shade and even the shape right, but most times people are going to be able to tell that this is not the same as that one, because at the end of the day this is porcelain and that one's your natural enamel. If there is an issue with one side of the midline, we always prefer to place two veneers, and we put one veneer on the other tooth as well to match them to look exactly the same.